Hi, my name's Jacqui. I'm the Lead Gynaecological Sonographer for QFW.
And I'm going to talk you through your Saline Infusion Sonography, SIS, at QFW. An SIS is an ultrasound procedure that provides information relating to the internal cavity of the uterus. An SIS uses salty water solution inserted into the uterus, which allows visualization of the lining of the uterus, the endometrium. An SIS is used to detect abnormalities of the lining of the uterus. You may have been set for an SIS to investigate abnormal uterine bleeding, infertility, recurrent miscarriages, or to detect uterine abnormalities such as fibroids or polyps, congenital defects assessing the shape of your uterus, or adhesions or scar tissue. The procedure needs to be performed between 4 to 10 days after the first day of your last menstrual period. We advise you to call the office on day 1 of your period to make a booking. If you have irregular cycles or infrequent periods, please call to be advised appropriately. Some patients may be asked to refrain from sexual intercourse prior to the procedure and/or have a pregnancy blood test. You do not require a full bladder for the procedure. It is recommended to take your choice of pain medication an hour before the procedure. You may bring a support person to your appointment, but it is not a requirement. What to expect? How is it performed? Upon arrival at our clinic, you will be asked to perform a urine pregnancy test to ensure you are not pregnant. A transvaginal ultrasound is required prior to the procedure. Once the pelvic ultrasound is complete, the doctor will use a speculum and insert a thin, flexible catheter through your cervix that will go into the uterus. As the catheter passes through the cervix, you may feel pain, and once it's in position, a small balloon on the end of the catheter will be inflated. You may experience some additional pressure or period-like pain. This should settle with time. The speculum will then be removed and the transvaginal probe will be inserted again so we can visualise the procedure. Saline, a saltwater solution, is passed through the catheter to check the cavity of the uterus. This is to assess for any scarring, polyps or fibroids that are difficult to assess on transvaginal ultrasound. The transvaginal probe captures real-time images of the cavity. When the procedure is finished, the catheter and probe will be removed. Some patients may feel lightheaded, hot or dizzy during the procedure. Some women may experience mild cramping that is similar to period pain. This will resolve shortly after the procedure, and pain relief can be used to alleviate these symptoms. If this occurs, please let either the doctor or sonographer know, and they will try to make you feel more comfortable. We allow 45 minutes for the procedure. This includes the transvaginal ultrasound and setup. The procedure itself does not take long and should be completed in about 10 minutes. When will I get the results of the procedure? As the procedure is performed, the doctor will explain any results and any additional pathology that may be discovered. Your results will also be sent directly to your referring doctor. You will also receive a copy of the report sent to you via a link called Trisify to your mobile. The time taken for your doctor to receive the written report will depend on the complexity of the examination and whether there is any additional pathology that has been seen. Immediately after the procedure, you may notice a watery or bloody discharge. This is the saline that was inserted through the catheter. You will be provided with a sanitary pad for this reason. It is normal after an SIS to experience some bloating, mild lower abdominal pain or cramping. This may be treated with any pain medication suitable for you. Bleeding and spotting are common side effects and should settle over the next couple of days. The SIS procedure is very safe. An SIS does not require ionising radiation or a general anaesthetic. It is not normal to experience bad pelvic pain, fever, or smelly vaginal discharge that is green or yellowish in colour. Pelvic infection is uncommon following the procedure, but if these symptoms arise, contact your GP or referring doctor as soon as possible. It is also okay to have intercourse after the procedure. If you have any concerns, please contact the referring doctor.